There we go. So good morning, everyone, and welcome to the Business Reopening Workshop, Reopening After the Provincial Shutdown, a day that we have all been waiting for quite some time. My name is Lynn Ladd with the Ottawa Board of Trade, and it's my honor and privilege to be representing OBOT today. We are the voice of business for the Ottawa business community. Our vision is to create an economic ecosystem that allows Ottawa businesses to thrive and to prosper, and we do that through leadership, collaboration, and advocacy. And of course, some of our greatest collaborators are with us and participating in today's session: Ottawa Public Health, the City of Ottawa, and OCOBIA, the Ottawa Coalition of Business Improvement Areas. I just want to point out today that there are so many of our BIAs on the call today. I know that Barrhaven is joining us, Canada Central, Westboro Village, Manotick, Spark Street, the Heart of Orleans, Bank Street, and Wellington West. So thank you so much for everything that you do on behalf of the businesses in your areas. It's greatly appreciated, and we're happy that you have helped share the message for today. I'd also like to welcome Michelle Grew, the new Executive Director of OCOBIA. If she's not yet on the call, she will be joining us later. So welcome, Michelle, and congratulations on your new role. So very quickly, before I turn it over to Dr. Moloughney, I want to make a quick announcement. Normally, the Ottawa Board of Trade affinity programs are directed exclusively to our members, but we have just adopted a new one that is very timely, so I want to share it with everybody today. We have partnered with a company called Get Ready. They're an IPAC consulting firm. IPAC is Infection Prevention and Control, and they have developed an app for employee screening and contact tracing. And we have entered into an agreement with them to provide this to the Ottawa business community, and we are opening it up to everyone, not just our members, which is unusual. Normally our affinity programs are for members only. So I've just posted some links in the chat. If you're interested in learning more about that, you can either contact me or directly visit those links. After Dr. Moloughney's presentation, there is going to be an opportunity for questions and answers. You can either turn on your camera and raise your hand, or you can post your questions in the chat. So Brent, if you are ready, I will turn it over to you to begin.
Great. Thank you very much, Lynn, and thank you all for coming here today. And you know, here at Ottawa Public Health, where I'm the Deputy Medical Officer of Health, I mean, we're kind of in this together in terms of making the reopening, return to the provincial framework, whatever you want to call it, successful. That we keep, you know, transmission of COVID down as low as possible, and that includes reducing the risk of transmission amongst your workers, as well as reducing the risk of transmission between staff and clients. Now on this call, I have a couple of colleagues, Crystal Taylor and Jenny Queen. I certainly see them. So thanks for coming, and they may also have some details if I get stumped, but also to track any questions that we're going to take away and get back to you. Contextually, I mean, we're obviously talking about the provincial framework, and by that name, you can realize it's written by the province. So we usually get it about the same time you do. We don't write the thing. We actually don't enforce it. That's what Bylaw Services does. But we view that we're here to help you understand what the expectations are, again, to protect your staff and protect the public. I will admit right up front that there are some gray areas in this framework that we're working on seeking clarification for all of us, and I'll flag those as we go. And so let me just do my best here to share my screen, and that's the one I want to share, and hopefully you can see that. Let me just turn that into a... So I guess the question is, can you see my screen of my PowerPoint slides? Because that's not what's in front of me.
We see the full screen.
Do you? Okay, great, because I've got ads for Zoom right now. So, and
Brent.
Sorry?
We still see the notes.
Okay, we're clicking my slideshow. Okay. Okay. How's that? Great. And I'm going to move this over here. Okay, here we go. So here we are, finally being able to reopen again, and certainly thanks to coming out, and also for, of course, the Ottawa Board of Trade for hosting this. And really, this sort of webinar is just one of the resources for information. We have lots of information on our website on this presentation, which will be made available after this to all of you. Have a number of hyperlinks to other sources, not just our own, but other important links that that may be helpful to you. So let me just continue on. So it's fun working on different platforms here. So really what I want to emphasize here is what's new in terms of the reopening, and talk a little bit about what the enforcement campaign that was done predominantly by the Ministry of Labor, and what we've learned from that, and really talk about the screening. So Lynn, that was very good to hear that that an electronic tool will be available to workplaces, because that is one of the changes for many, and also talk about the importance of safety plans, which was a point of emphasis from the inspectors, as well as talk about anything else in terms of what we're seeing, as well as changes to the framework. In the overall context of things, it's important for people to be able to get out and access services. It's important for people to be able to go to work. All these are important for people's well-being, and we're happy to contribute. And of course, while doing this, to make it as safe as possible as we attempt to live with COVID. As per my opening comments, the province is the lead authority for many of the COVID-related policies and restrictions. At the local level, we're more in the interpretation and support. We generally don't have powers to change these authorities or lessen them. We can increase them with our own orders or add to them, but we can't modify the existing restrictions that are generally in provincial regulations. Overall, with reopening, but intrinsically means there's going to be some more potential interaction between people, which increases the risk of transmission, which obviously can get us into trouble again, in terms of people becoming ill, being hospitalized, or perhaps even to die. And the trouble that we got into in December, where our numbers went exponential. We doubled, and then we doubled again, all in a 1 month period. We went from a time where I can remember talking to business groups towards the end of November, and we were almost getting to yellow, but then we proceeded to just go right through orange into red, and then almost hit gray. And of course, you know that the province put basically the whole province into a shutdown, as they were seeing similar things elsewhere. So the interactions, now, they're predominantly what drove things was social interactions, but we also saw transmission in workplaces, and I'll talk a little bit about that shortly. One of the concerns always is, when things open as they are now, that people will get overly enthusiastic and think it's a return to our pre-COVID normal, when actually we need to continue to reduce the risk of transmission, continue to be living COVID-wise, to prevent that transmission from taking off again. And certainly with the variants, which are on a provincial level, are increasing in numbers, are increasing the potential for transmission even more. Here in Ottawa, while our case numbers are down, we are seeing some signs around the amount of virus that's in sewage or wastewater that is of concern. The positivity rate, which is the proportion of tests that come back positive for people being tested, is also plateauing. So there are some signs that there is the risk of this increasing again. So we all have to do our parts to try and limit the risk of transmission at work and our workplaces, as well as at home and with our families. In terms of the education inspection campaign that was held in December and January, those blitzes focused on retail businesses, restaurants, personal service settings, and identified correctable issues. Overall, most businesses were following the measures that are in the regulations, but there were a few areas of interventions or areas that for improvement. Overall, 80% of the infractions could be prevented by addressing employee screening and workplace safety plans. So I'm going to spend a bit of time on both of those. I sort of alluded to this, but we know how to prevent this disease. The issue is being able to consistently apply these in all situations. It's kind of a human tendency to go, well, it's okay if we do it here. We know those people. They don't have COVID, and we have psychological mechanisms that try and in some ways to give in. So it's really being consistent in terms of your practices at work and at home in order to reduce transmission. And you've heard it many times before, but I'm going to say it again. Wearing a mask is very effective. It needs, we've got information on our website in terms of types of masks and the importance of things that fit well. Certainly, and we're going to get into this in screening, is that people who have symptoms should not be coming to work. They should not be going to school. There's not a lot of other viruses out there. I mean, we've seen almost no flu this year. A lot of the other viruses that occur in the winter, we're seeing very little of. So there's no such thing as just a cold. I mean, if you've got symptoms of a cold, then have to worry about that you may have COVID. Other things in terms of that distance is really important. And if there's those circumstances where you can't maintain distance, should be having a mask on. And of course, in a workplace, if there's repetitive exposure opportunities, then there should be plexiglass or some other barrier. And of course, hygiene, hand hygiene. As I said before, I mean, things that we were seeing December, the transmission in workplaces was less than the social interactions outside, but in some cases they were linked. People had transmission at work and then proceeded to have social gatherings, which then continued to spread things. The thing in workplaces, and sometimes it's easy to think that the risk is the public. Certainly you have to think about that. But the bigger risk and the more common transmission that we see is actually between colleagues. We have a tendency to let our guard down because these are people that we work with. So we see, during breaks, during lunch, carpooling, those sorts of things where people don't follow the COVID-wise rules, where they don't maintain distancing, they're taking their masks off, and exposure occurs, and then transmission. Sorry, I've got phones going. Let me just shut that off. Sorry about that. So in order to certainly to protect your employees, it's important to have them protected, from their interaction with the public, and the steps I'm going to talk about those shortly. But the first thing is really the risk of transmission between colleagues. I can remember one time talking, it was a library, and there was a lot of talk about worry about the books. And eventually I had to sort of stop them. I said, okay, there's things that we need to worry about with the books, but quite frankly, the risk to the librarian is the other librarians. And their eyes kind of got big. And then we talked that through. And then, yes, the other thing is that your attention needs to be not just on sort of the public facing piece where your clients are, but what happens in the back office or backspace of your workplaces, because again, that is a major risk of transmission source. And it's really a series of pieces that need to fit together to be able to have protection for staff. First off is that they shouldn't be coming in with symptoms. And so that is a point of emphasis in the new framework, is that there needs to be screening for staff every day to ensure that they do not have symptoms or risk factors. In addition to that, that people are wearing a mask. Medical mask is particularly recommended where you're serving close to patrons and not wearing masks and they're not wearing masks when eating and drinking. But also that mask wearing in the back office aspects as well. In addition, as things I said before, maintaining distancing. Eye protection is quite relevant for some settings. For example, restaurant servers where the clients may not be wearing a mask and that 2-meter distancing may not be attainable all the time. And of course, the hand-eye hygiene piece as well. In terms of this reopening, as I said, there's active screening now for all employees. And that means the difference between active and passive is this. Passive screening means essentially there's a sign on your window or your door as people come in to remind the patron that they shouldn't be coming in if they have any of these symptoms. Active screening means actively ensuring that, let me take employees first, that your employee, before they come in, have gone through that list. Now you can do this manually. There we have, and I'm going to show you in a subsequent slide, we have forms that you can get off our website where that people can fill out and that you could store. Similarly, you can do it electronically, where people would answer the questions and make sure that they're good to go to be able to come to work. The key thing from an audit perspective, for if you were to, for example, to be inspected, is that you have a record that that screening has occurred. So that's the piece that you need to think through in terms of how you're going to track the fact that there has been active screening for all your employees. So now I'm going to come to the gray part of the provincial framework that we're still a little bit unclear of, and that is the extent to which there's active screening for all customers. And as I said, we're working on this because for Orange, which is where we are in the color coding of how much COVID's going on, the provincial framework seems to suggest that a number of settings need to do active screening for all the customers. And that list includes, but not necessarily limited to, gyms and fitness facilities, restaurants and bars, personal service settings, cinemas, and casinos. The challenge is the way the province did this is that the requirement is not reflected in the regulations, which normally you can just go to with the statement, find it in the regulations, and it goes, okay, that's what it says, that's what we need, that's what bylaw would enforce. They've written it in a strange way or a different way where they're referring to it as a direction from the Chief Medical Officer of Health, which does have authority under the regulations, because it's still, there is a clause in the regulations that says any requirement by the Chief Medical Officer of Health it needs to be followed. The only problem is when you click on the hyperlink, it doesn't take you to that instruction, but rather to an online screening tool. So what I would say at this point as my best advice, knowing that I don't enforce these things, but I would say that if you're doing active screening of your patrons, don't stop. If you're in one of those settings that I described, start thinking about how you would do active screening, because I think that you will need to be doing active screening for all your customers as they come in. So in other words, if you run a hair salon and someone is showing up for their appointment, you would, similar to your employees, need them to go through the list, or that you've walked them through and then they've said, yes, I have none of those. And then you would record that. So that's what I think you're going to need to do. We, as I said, are in the process of checking with the province, as well as our lawyers and bylaw, because we're trying to get everyone in sync here in terms of what actually the province is requiring. And as soon as we get an answer and we have that request in, we will then push out that answer through our various channels, including this organization, so that you know for sure. And that's the best I can sort of say at this point in terms of the uncertainty. In addition to that, there are some capacity restrictions for some sectors, although they predominantly apply for higher colored areas. We have some of our own guidance and letter of instruction, which I'll get to. And then, of course, safety plans are required at all levels, which I'm going to talk more about. So, as I said before, I mean, we have the ability to supplement.
Like, do you have a fever?
Yes.
I'm sorry. Yeah, thank you. As I said, in addition to what the province puts in their framework, we can't subtract from that. But if we see that there might be something else that we want to add to, particularly if we are seeing things in the community that we think we need to respond to, then we can add to that. And we've done so in terms of a letter of instruction. And a couple of those apply to workplaces, and we sent that out before the December holidays. One of those was to say, listen, if you see 2 or more COVID cases in your workplace in the last couple of weeks, give us a call, because you may have transmission in your workplace, and the sooner we can know about that and realize that the 2 cases are maybe linked, the quicker we can investigate and put steps in place to prevent transmission and follow up with people who may have been exposed. The other thing was around capacity limits. Now, the province, did put capacity limits in during the shutdown for those places who are allowed to stay open. There are also capacity limits at the higher level colors, but so that at this point there aren't under orange, under the provincial framework, but are still apply in terms of a requirement for retailers to calculate what their capacity limits are in order to maintain the patrons being 2 meters apart, and to post that and to monitor that. And that, again, is something that's auditable by inspectors. And more information is on our website in terms of how you go about calculating and determining what your limits are. In terms of resources available to you, there is our business reopening checklist that's been added and is available at the link that's there. We also have updated the reopening toolkit. I think we started that way back in around June, and so that's now been updated and it's available on the ottawa.ca website that's showing. And then here are a couple of tools. I mean, this would be in addition to that new tool that Lynn talked about that you'll want to learn more about. On the right-hand side here is a manual kind of thing that you can print out just to have employees fill out, and then you can keep that as a record. There's also an online tool, but of course, what you would need to do then is have something to track that the person has actually completed it. I don't know if, and then maybe can talk about the tool that's looking for Board of Trade and other members in terms of whether it'll help you track whether or not people have completed, because again, that would be something that an inspector might ask of you. I was talking about passive screening earlier for clients, and here's the kind of signage that's available from us on our website that you can just have posted, and that's fine for passive screening. But then you would need a similar tool like this one on the right-hand side, or the one that's scannable that they could fill out for you, and that then they would reassure you that they've passed it, and then you could just note that they had completed the screen successfully in your notes. Because in many of those settings, you're also taking their contact information, so then you could have something beside that in terms of that they passed screening as well. Okay, switching a little bit to the other piece that was an item of emphasis from the inspections that Ministry of Labor did was around a safety plan. And mandatory safety plans are required for multiple sectors that you can see there. And what I would say about these plans is you need to have a written plan that an inspector can see that you have it. But quite frankly, the real importance, or the stronger importance, is the fact that you've gone through the process to think it through for your particular workplace, because one size and one answer doesn't quite fit for everyone. And so there are a series of questions that are available to walk through and prompt you to think through what you need to have in your plan. And so, for example, the question one there that you see on the screen is in terms of, well, what are you going to do to ensure all your workers know how to keep themselves safe? And so the sorts of things that, there's a prompt, what guidance will you need to provide, are around, communication. What kind of notices might you do? Will you have emails? Will there be virtual team meetings instead of meeting in person? Will there be intercom announcements? Will you build into your virtual team meetings that there's a reminder of how we need to keep ourselves safe in our particular workplace? And then, when new information becomes available, how it will be shared. Another piece would be training. What training will you provide and to ensure that they do the particular work that's in your area in a manner that's as safe as possible? So those are some pieces for that to be thinking of. Question two is, well, how will you screen? Well, we already talked about that you need to think through how you're going to be screening every employee before they enter the workplace. Step one is keep COVID from coming in. And so will you do that with a manual form? Will you do it with an electronic form? How will you track this? And then the other piece here, which we're going to get more information for you on, is will you need to actively screen all your patrons? And I think you want to start thinking about that if you're within one of those settings that I identified. Question three is, how will you control the risk of transmission in your workplace? So again, this depends on your type of workplace you have, but thinking through, so where will potentially people are at risk of not being 2 meters apart? Where, how will we be supporting the use of masks? Where will we need to have plexiglass? And you will have thought through most of this, but this is an opportunity to think it through again and say, are there any opportunities to improve this and to document this, that this is your plan of how you're going to prevent transmission in your workplace. So for masking, that all staff are required to wear a mask while at work, as well as customers being required to wear a mask while not eating or drinking. Making sure your ventilation system is maintained according to manufacturing requirements. If you're able to have an open window, obviously that's easier in warmer temperatures to have more fresh air, then that's a good thing. How are you going to reduce transmission from surfaces and objects? Is there a way to reduce the amount of touching of things by different people by changes in work practices? And what kind of cleaning and disinfection processes will you have in place so that surfaces are cleaned on a regular basis? Having reminders, posters, infographics on proper hand washing, and reinforce that this is important to do and that people have access to that. Making sure that people have proper cough and sneeze etiquette. It's always interesting to listen to some providers, sometimes in healthcare, where people will lower their mask in order to sneeze or cough, which of course defeats the purpose. And of course, in addition to masking, if based on your workplace, whether there's any additional personal protective equipment that's required. Question four, what do you do if you happen to have a case or a suspected exposure? So the answer is you give us a call. So we're giving you the number there. Certainly, for sure, if you have 2 or more people test positive within a 14-day interval, then as an employer, you want to be giving us a call, because it should be going through your head that, we may have transmission here. Maybe it's chance. It just happens to be 2 people in the workplace. It wasn't transmission there, but don't assume, and give us a call, and we will help you work through what needs to occur. as I said, many settings, there's a requirement for you to have contact information, and so that if we think that there has been significant exposure to clients, then we'll work with you in terms of how to inform those individuals that they require follow-up. Oops, sorry about that. Okay, that was that one. Question 5. What if risks change? And so really it's, if there's a change in your practices, if there's new information that comes out in terms of risks of transmission, then you need a way to change your plan, and have new training for any new hazards. And then with any plan, you need to sort of take a step back on a periodic basis and say, how is this working? Are there any changes that we need to make? Often it's helpful that collecting feedback from staff, for example, and customers is helpful to get some input. And typically there's a lead person in an organization that is identified and assigned that role, that they're the COVID lead. There's more information on our business and workplace webpage. Certainly all of the resources that have mentioned here are available there. And we'll also have an opportunity on our website so you can subscribe to our bi-weekly newsletter for businesses and workplaces where we provide relevant info and updates for COVID. And on our on the slide here, as I said, there are a number of resources and hyperlinks in terms of our posters and others that I've mentioned, as well as other sources of information from the Government of Ontario. And for completion, about resources for employees, be COVID-wise, the health screening questionnaire, if someone has symptoms, what they need to do in terms of self-isolation and testing. Here in Ottawa, we do have a voluntary isolation center. What that means is that if you need to self-isolate, but because of your living conditions, it's not feasible to isolate from other people in your home, or you're not going to be able to look after yourself, at no charge, there is a center here in the city where people can self-isolate for up to 14 days, depending on their timing, and have meals brought to them, etc., and have people sort of phone and check up on them daily to make sure they're doing okay, as an option. And then some people have issues around income, so it's certainly, and I think it is in our business information letter instructions to make sure that employees are aware of the support benefits that are available to them. And of course, always a good idea to have the COVID Alert app on our cell phones so that we can be alerted if we've been in contact of a sufficient duration with someone who has COVID. So that's a lot of information to throw at you, and probably even more important is the questions that you may have for me. And as I said, I'll do my best. We have some people from the team here as well. Thank you very much for the support for doing this, and interested in any questions that you may have. So thank you.
So Brent, we have a number of questions that were posted in the chat as you were speaking. So we'll start with those, and then we'll open it up certainly to other questions that arise. So the first one that was posted was from Laura, and they asked, will you be discussing about indoor sports, recreation, and the fitness industry as gyms are reopening, which everyone is very grateful for? And also is asking, will you be discussing to what extent and how high of a priority is it for disinfection of touched surfaces as a measure of preventing COVID-19 transmission?
Okay, so let's do those in reverse order. So I would say objects in general are less risky than people. So I remember, I think it was one of these sessions, and it was, I think it was like a farmer's market or something, and they weren't going to be able to do electronic transactions because they didn't have internet access. And so they were worried about touching of money. And I said, we could talk about the money in a second, but more important is the person that you're dealing with as a client. And so how close are they getting to you in order to pay you the money? They actually are the risk to you and your staff. Okay, so you got to be thinking of a way to have distance between you and them for the money. And so then, yes, theoretically, we might have COVID transmission on an object or a surface, especially the sooner someone touches something. But of course, we don't get it through our hand. We then have to take our hand and put it up to our face and have it touch our eyes or nose or mouth. So as long as we don't do that, we're okay. But of course, people do that all the time. They do it subconsciously. So that's the problem. So normally our advice is that, high touch surfaces, the doorknobs, the handrails, the tops of surfaces should be being cleaned at least a couple of times a day with a disinfectant. And of course, for our staff, we're reminding them to be using good hand hygiene after they touch objects and be doing that regularly. In terms of the fitness facilities, I wasn't quite sure what aspect was being looked for. Certainly, we have guidance for fitness facilities. Certainly, there's a need under the regulations to get information on patrons. I believe, as I said, you're in that group that you're going to need to do active screening of the patrons. There is information in the regulations in terms of the distancing, the extra distancing that's required in certain areas between, for example, fitness equipment, cardio equipment. I know Crystal or Jenny, would you have anything else to add off the top of your head in terms of those facilities?
You covered the main ones, Brent, and I just included a link in the chat to our updated guidance document that has the full guidance for fitness facilities. And in the coming weeks, we will also be having a webinar targeted to sports and rec or around team sports. But if there is a great demand for more information specific to fitness and gyms, that's something we can consider as well if there's additional questions that you can't have answered in that guidance.
Thanks for that, Crystal. Yeah, so I would say, look at our guidance that Crystal provided in terms of the link there, and if you have still outstanding questions, to contact us. With respect to team sports, I think that was maybe included in the question. I mean, the same requirements or restrictions apply that applied before the shutdown in terms of leagues are limited to 50 players. And so we've put advice out certainly to the hockey leagues in terms of ideas of trying to prevent transmission. Certainly last fall we did see transmission in team sports. A lot of it seemed to be around the ancillary activities that come along with team sports. So not the playing of the sports per se, but the carpooling, team meals, dressing rooms. I would also add some parental tailgating while players are playing. Some of the training where people weren't maintaining distancing and masking while players were on treadmills and coaches were really close, coaches not masking. I mean, it was a long list of things that really weren't directly for the playing of sports that go along with it. So we have information that we've pushed out to the leagues in terms of trying to make this as safe as possible. So again, check our guidance on recreation. If there's still questions, then we're happy to answer.
So there's a follow-up question for you from Laura, and specifically asking, has there been a conclusion about how long COVID-19 survives on hard surfaces?
It depends on the surface. For sort of hard, absorbent materials like plastic and metal, it's at least 24 hours. Some studies are a little bit longer than that. Items like paper and cardboard, less so. But it's imprecise. One of the challenges with the studies is they detect virus, but not necessarily infectious virus. So it could be particles or inactivated. But those, generally the hard surfaces certainly will last longer. The absorbent surfaces less.
Great, thank you. We have a number of questions from Bode Spa. So the first two are fairly easy, so I'll ask those, but Bode Spa, I'd love it if you could turn on your camera and mic for the third one. So we're going to start with asking, can you confirm, Brent, medical mask, does that mean a 3-ply mask?
So, okay, so there's a difference between like a cloth mask, non-medical mask that has 3 layers, which is what we recommend right now for everyone. And with the middle layer having different filtering properties than the other 2 layers. Now, a medical mask is actually a procedure mask that has a designation from NIOSH or another certifying body that it's and there's 3 types, but usually type 1 is fine for most purposes, that will have certain filtering properties and is more and has predictable filtering properties compared to something that you're making yourself or that you're buying as a non-medical mask. So it's going to have a certification on it as a medical procedure type mask, and as I said, it will have filtering properties that are dependable compared to a cloth mask.
Great. And the second question, which is really appropriate since we have so many spas and estheticians on the call today, is customer screening requiring a written record to be kept, like with employees, or is verbal screening sufficient? And to follow up with that, almost every salon and spa keeps great records of their clients, including their information, their contact information. So is it enough to simply mark in their client records that they are have been screened accordingly?
So it's unclear to me from the guidance as to what the specific requirement is. As I said, we're still checking on whether it's actually required. We think it is. And I'd like to see what the instruction is in terms of what the wording is. I think at this point it would be reasonable to have noted that you did the screening, that you did active screening with this client and they passed.
So Bode Spa, did you want to ask your third question? Because it's a little complex. So I'm going to invite you to ask it directly.
Sure thing. Hello, everyone. So the question for the safety plan is the only page that I really struggled to come up with answers for. And it's the question of what to do if someone suspects being infected in your workplace. In this webinar, you said, call OPH. Okay, we'll do that, but what else do we do? Do we have to shut down? I read through the OPH website and it says that we have to send the employee home immediately and sanitize their workspace. I only have 2 or 3 estheticians and I as the owner am not in that city. So who's responsible to disinfect that person's workstation? If they don't feel safe, they don't have to do the work, but I'm not there to do it myself. So there's a lot of gray area on how do we safely send someone home, clean up the workspace, and then what else am I supposed to do? Do I have to shut down? If yes, how many days? Do I have to contact all the clients that that person cut their hair or saw that day? If yes, do I do it for just that day, or do I call clients for a whole week's worth because possibly they were, infectious? So there's a lot of things that are not covered there. So I'd like for you to kind of help us. What should we as spas and businesses do when someone shows up or during their shift says, I think I'm positive?
Okay, so let's do some of this in reverse order. A lot of good questions, and I'm glad you're asking and trying to think this through. Okay, so we have an employee who has symptoms, not feeling well. Okay, get them out of the workplace. Say, thank you for raising that. Please stay over there away from me and from other people. Let's make sure you have a medical mask on. Please go home and please get tested. Because it's a difference between someone having symptoms and knowing someone has COVID. Okay, so you're doing the right thing. You're screening. If they start feeling sick during their shift, comes to their supervisor right away, whether they're on site or not, and says, "I'm feeling sick." You say, "Isolate yourself from other people, and you need to go home. Please get tested and tell us what the answer is."
All right, right there, just one follow-up to that is because they feel unwell. Must I have documented proof that they got tested and that it was negative before they were allowed to return back into the workspace?
Well, because they have symptoms, they actually are going to need to isolate for 10 days. Sorry, from the time of onset of symptoms. Now, if they have a negative test and they have been feeling well for at least 24 hours, then they can come back.
Okay, so self-isolate for 2 weeks and get tested.
So 10 days. Sorry, 10 days, because that was guidance that changed.
Okay.
So everything used to be 14 days.
Yeah.
14 days remains if you've been exposed to someone with COVID and we think you're a high-risk contact. So we'll put that aside for a moment. That's going to come back in a second. If someone has symptoms and has COVID, then it's from 10 days from the onset of symptoms until we view that they wouldn't be infectious. Now, for this person, we don't know, but we have to be, you know what, you got COVID until proven otherwise kind of thing to be safe here, right? That's kind of the sort of underlying premise here. So yeah, please go home, please arrange to get tested. And it's really easy to get tested these days. Like you often get an appointment the same day or the next day, and then the results are coming back for people with symptoms within about 24 hours or so. So this is pretty quick to be able to sort out. So they go home, they get tested. If they come back negative, then they can say, listen, I'm negative and I've been symptom-free for 24 hours. They can come back. Now, if their test comes back positive, then you have all these questions and there's no recipe book where you just open this up and go, okay, it's a spa with a case and here's all the things. That's the questions that we're going to want to find out. Okay, so what days did they work? And we'll know when they were positive. We get copies of all the positives and we follow up with all the positives to figure out who their close contacts are. But we would work with you as the employer to figure out who was potentially exposed and is a high-risk contact that we need to communicate with. And depending on, the use of PPE and the type of work and the distancing, we'll figure out how do we classify your patrons? Are they low risk? Are they high risk? And the action we do in follow-up depend on that answer. And so we have a whole case management team that just does this for a living.
Okay, so
we will work with you to figure out who are the high-risk contacts and what do we need to do for them.
So then would a good summary basically be send them home, tell them to get tested and wait 10 days, or be symptom-free for 24 hours or more with a negative COVID test? And then if someone tests positive, call OPH and you guys will walk us through.
Yes, for the last part. For the first part, yeah, so they got symptoms, they go home up to 10 days. They're able to come back if they have a negative test and they've been symptom-free 24 hours.
Yeah. Okay, great. Thank you.
Welcome.
Can we circle back very quickly because we do have other questions, but I'm not sure that we adequately addressed the answer to the question about salons and spas keeping detailed records on their clients anyway and making a notation beside the client name at their appointment saying, yes, this person's been screened. Is that considered adequate?
So you're going to have the contact information for these people, just in case we had to do the contact tracing that we just talked about with the spa, right? Because we're going to need that. We're going to need the list and work through who maybe got exposed or not. Our guidance at the moment, and Crystal, please jump in, I think would be to say, when you're doing the active screening of the patron and say walking them through the questions, I don't think you need a record of all the answers to all those questions. What you need is a record to say that you did it for that patron. And if the information we get from the province or from bylaw is different to that, then we will inform you.
That's a very direct and clear answer. Thank you.
Okay.
The next question comes from Judy, and she's asking, how long would those active screening records need to be kept? And how does keeping these active screening records impact privacy laws?
So I don't think there is a privacy piece here. I mean, you're required under provincial regulations, under the law, to capture this information that this person attended your facility so that we can follow up if we need to do contact tracing, and that you have fulfilled your obligation, which I think you need, we're going to confirm that, to do active screening. There's no personal health information in there. I don't think that there's a privacy piece, and you're not disclosing this to anyone else other than Ottawa Public Health. If we need this information, that would be the contact information, or a government inspector who is checking if you are complying with the regulations.
Great, thank you. Stephanie's question is the COVID-19 safety plan similar to the operational guidance during COVID-19 outbreaks for childcare? And Stephanie, if Brent needs some clarification, do you want to unmute your mic and hop in?
Hi there. I'm just wondering, all childcare facilities have to write a policy, operational guidance policy for COVID, and I'm just wondering if the safety plan is similar to that or if it replaces it.
I don't know that, I mean, I suspect, Stephanie, that you're right. I haven't had that question before. And I also am not sure if the regulations requiring a safety plan actually apply to childcare, to be honest with you. Like, I mean, there's some exceptions for certain types of places. So I think we'll take that, unless Crystal, you know the answer off the top of your head, I think we'll take that one offline and get back to you. Because I can see it's unnecessary if it's covering the same information, and I'm not even sure it applies.
Right, Brent, that the workplace safety plans, I believe, are more for businesses, and that childcare has its own regulations. But we can certainly confirm, Stephanie. It's my colleague that leads our childcare work, so it's not as top of mind, but we can reply.
Yeah, that'd be great if they can get back.
Oh, sorry, go ahead.
No, that'd be great if somebody can get back to me with regards to that.
Stephanie, I'll make sure that Ottawa Public Health has your contact information so that they can communicate with you.
Fantastic, thank you.
No problem. Next question comes from Lindsay. If we are a retail store that is choosing not to reopen, but still have staff in to process online purchases, would these new regulations be applicable?
So if you have workers in your workplace, then yes. You know, you don't, I mean, let's just say, put aside the regulations, you don't want workers with symptoms to be in your workplace, right? Just like you want them to stay home. So my sense would be that yes, you are going to want to make sure that anyone coming into your workplace is screened and that there's a record of that.
Thank you. Question from Allison. Allison is asking about working in a small office environment with about 10 people, and their team has been working from home, but they're wondering if they can reopen the office now under Orange, or should the employees continue to work from home?
So our general advice is, if you can do work from home, stay at home. We are, for places that have people in offices, because it's the nature of their work is essential and they need to do so, we are continuing to see transmission in those workplaces. So the more that you can keep people at home in order to get your work done would support you to do so. In terms of whether you're allowed to do it under the regulations. I mean, you'd have to look at the regulations and see how they apply to you. And there's a government phone number that also can assist with that. But a general principle from a public health perspective is if you can get the work done from home, do it there.
Very interesting question from Kim. Can you ask an employee to go and get tested if they say they have one symptom? Are we allowed to ask them to get a test? And can an employer ask for proof of a negative COVID test before the employee returns to work?
So we really can't ask people to be tested. I mean, even I can't require someone to be tested, but I can have implications if they don't. So for example, in an outbreak or something, I could say, well, either you're away for this amount of time or there needs to be a negative test. So if someone has symptoms at work, and it doesn't matter how many, one is enough, because some people have mild presentations of COVID. They fail the screening and they then need to go home. And then so it applies to my earlier answer to the person with the spa, is that they're at home for 10 days from time of symptom onset unless they have a negative test. And I think it's reasonable that they would be able to show that negative test. But part of my brain is questioning in terms of the privacy side of that. And so we will get an answer back to you. I just want to confirm that piece in terms of being able to demand proof of that. So we'll get back to you on that, Lynn, and the rest of them on terms of whether you have the ability to demand that.
Yeah, I'll make sure you have Kim's contact information. So we have time for the last two questions that have been posted in the chat. Reg wants to know, do financial institutions need to active screen or is passive screening sufficient? I'm presuming that means something like a bank that might have high traffic.
So certainly you have to active screen your employees because that applies to all workplaces. I do not believe that they are identified as a specific institution that needs to do active screening of patrons. I can see Katrina looks like she's on her computer, and I suspect is looking at that. But no, I know retailers are not identified. They just need to do passive screening, and unless they're identified in the framework, and I don't recall seeing it there, that a financial institution would not need to.
Thank you. And we have time for the last question from Allison. If an employee has environmental allergies, which have a symptom of runny nose, and it's constant, should we have them avoid going into the office indefinitely?
Yeah, no, this is the challenge with, some of the symptoms can be other things. So the runny, congested nose, for some people, cough can be as well. And so if you take a closer look at the screening tool, there is provision for it's different than normal for them. So it's a change in your stuffy nose, for example.
Thank you. I missed a question, and thank you, Crystal, for pointing that out. From Veronique. Veronique runs a home spa in Orleans and has 2 kids in school. If they need to isolate due to exposure or have symptoms, can she reopen once their test comes back negative, or does she need to wait until all the symptoms are gone?
Okay, I'm just thinking this one through. So we have a home spa, 2 children. So one of the children starts having, say, a runny nose or a sore throat. Province has just gone back to a single symptom screen. So that child would not be able to go back to school until they have a negative test and their symptoms improving. The other members of the family, so the other sibling and the parent, and therefore her home spa business, they're all self-isolating and not going out until that child has a negative test. Once that child has a negative test, then we're waiting for them to improve before they go back to school. But the sibling, they can go back to school as soon as their brother or sister has a negative test, and then the person would be able to have their business as well operate.
All right, I saw one final quick question sneak in. Can an employee wear a shield rather than a mask if they have health issues?
So under the mandatory mask bylaw, but also the provincial regulations, I mean, so it's mandatory to wear a mask, but there are a number of exemptions. Those exemptions should be fairly rare, but they can apply. In that instance, wearing a shield actually would be preferable to wearing nothing at all. It's not as good as a mask because the whole way a mask works is to filter the air to take the droplets out. A full face shield will stop, some of the droplets, but it's still possible to get around. So it's better than nothing, but not as good as a mask. But if someone has a legitimate exemption from wearing a mask, then it, as I said, is better than not wearing something.
Excellent. Thank you so much. So I see that we are out of time. It's now 12:01, and respecting everybody's time, we'll wrap up right now. I want to remind everybody that as soon as I can get the recording posted online, I will send out the link to the recording so that you can rewatch it if you need to, or if you want to share it with your team to help educate them as well. We'll also include a copy of the slides from today. And I have a full list of resources that are fully linked from OPH that might help you as well. I'm also going to invite you to email me specific questions, and I will share them with Ottawa Public Health. Every little bit of feedback and all these questions that you ask are very instrumental in them into helping to understand what the needs of the business community are. And they are equally anxious to make sure that your questions are answered. So don't be shy about reaching out with your questions. We'll help you get taken care of. So thank you so much to everybody for joining us today. A huge thank you to Ottawa Public Health for taking the time to help educate the business community. Dr. Brent Moloughney, thank you once again for yet another instructful session. And I wish you all a safe reopening and a lovely afternoon. And I hope your businesses thrive and prosper. Have a great day, everybody. Bye-bye.
Great. Thanks, folks.